Imagine eating bread and instead of feeling satisfied, your immune system starts a food fight inside your gut. That's celiac disease in action. Hi everyone, I'm Dr. Razayan, a specialist in autoimmune diseases. Today we're going to take a full journey through celiac disease, from what it is to how it's diagnosed, treated, and even where research is headed. Before we start, remember, this video is for education and inspiration only. It's not medical advice. Please consult your healthcare provider and always double-check information with trusted medical sources. What is celiac disease? A chronic autoimmune condition triggered by eating gluten, the protein in wheat, barley, and rye. In genetically susceptible people, gluten is modified by an enzyme called tissue transglutaminase. This sets off an immune response that damages the small intestine. The damage includes increased inflammatory cells, overgrowth of the intestinal crypts, and flattening of the villi that normally absorb nutrients. Most people with celiac disease carry either the HLA-DQ2 or HLA-DQ8 gene. Having these genes increases risk, while not having them makes celiac disease very unlikely. How common is it? Celiac disease affects about 1% of people worldwide. The number of diagnoses has increased over time, partly because doctors are looking for it more often. Risk is much higher in first-degree relatives, around 10 to 20%. It's also more common in people with other autoimmune conditions, such as type 1 diabetes and autoimmune thyroid disease. Symptoms: the wide clinical spectrum. Digestive symptoms: chronic diarrhea, fatty stools, bloating, stomach pain, weight loss. Common non-digestive symptom: iron deficiency anemia. Other possible effects: bone problems like osteoporosis and fractures, liver inflammation, infertility and pregnancy complications, a unique rash called dermatitis herpetiformis, nerve issues such as numbness, tingling, or balance problems, and mouth ulcers. Associated conditions: type 1 diabetes, autoimmune thyroid disease, autoimmune liver disease, genetic syndromes such as Down, Turner, and Williams, selective IgA deficiency, first-degree relatives with celiac disease, people with unexplained, persistent liver test abnormalities. Diagnosis step by step, always done while the patient is still eating gluten. Step 1. Blood tests. The most common is the tissue transglutaminase IgA test, plus a total IgA level. If IgA is low, other IgG-based tests are used. Step 2. Endoscopy with biopsy. Doctors take several samples from different parts of the small intestine. Under the microscope, pathologists look for increased inflammatory cells, crypt changes, and villus atrophy. Step 3. In children, sometimes a biopsy isn't needed if blood tests are strongly positive and confirmed by a second antibody test. Step 4. Genetic testing. Not required for everyone, but very useful if results are unclear or if someone went gluten-free before testing. Step 5. If already gluten-free, doctors may consider genetic testing first, followed by a supervised gluten challenge before repeating tests. Differential diagnosis: other conditions to rule out. Non-celiac gluten sensitivity, wheat allergy, small intestinal bacterial overgrowth, microscopic colitis, pancreatic insufficiency, irritable bowel syndrome, immune deficiencies, certain medications that can damage the intestine, like olmesartan, Crohn's disease, tropical sprue. Management. The cornerstone is a strict lifelong gluten-free diet. This requires expert guidance from a dietitian, label reading skills, and strategies to avoid cross-contact at home, restaurants, and during travel. Most patients can safely eat gluten-free oats, though some may still react. Replace key nutrients: iron, folate, vitamin B12, vitamin D, and calcium. Bone health. A baseline bone density scan is often recommended, especially in adults, with repeat scans as needed. Vaccines. People with celiac disease may have a reduced spleen function, so pneumococcal vaccination is advised, along with standard vaccines like influenza and shingles. Dermatitis herpetiformis, treated with a gluten-free diet plus the medication dapsone, which can be tapered once the gut heals. Follow-up and monitoring. Early follow-up around 3 to 6 months after diagnosis, then every 6 to 12 months. At visits, doctors check symptoms, diet adherence, blood work, and complications. Blood antibody levels usually drop as the intestine heals. If they stay high, it suggests ongoing gluten exposure. In adults, some doctors recommend a repeat biopsy after about 2 years, especially if symptoms continue. Non-responsive and refractory celiac disease. Non-responsive. If symptoms persist after 6 to 12 months on a gluten-free diet, doctors check for hidden gluten, other gut conditions, or intolerances like lactose and fructose. Refractory celiac disease, a rare form where the intestine doesn't heal despite strict gluten avoidance. Type 1. Immune cells look normal under the microscope. This is usually treated with steroids like budesonide. Type 2. Abnormal immune cells are found. This type has a poorer outlook and is managed at expert centers. Treatments may include strong medicines like cladribine, with monitoring for a cancer called enteropathy-associated T-cell lymphoma. Complications. If untreated or poorly controlled, celiac disease increases the risk of osteoporosis and fractures, severe nutritional deficiencies, pregnancy complications, rare but serious cancers of the small intestine. Emerging therapies. Research is underway on non-dietary treatments. Examples include TG2 inhibitors, which block the enzyme that triggers immune activation. Other approaches being studied: medicines that strengthen the gut lining, gluten-digesting enzymes, and therapies that block specific immune pathways like IL-15. None of these are approved yet, but progress is being made. Engaging and inspiring. So, while celiac disease may mean saying goodbye to regular bread and pasta, it doesn't mean saying goodbye to a full and healthy life. With early diagnosis, the right diet, and good medical follow-up, most people do extremely well. And the future looks even brighter, with new treatments being studied that may one day give patients more options beyond diet alone. I'm Dr. Rizayan, specialist in autoimmune diseases. Thank you for joining me on this deep dive into celiac disease. Stay curious, stay informed, and take charge of your health.